And in a world that we're so connected with phones and computers that we kind of need it for everyday life, especially even for jobs. If someone's diagnosed with a gaming disorder, what is a standard protocol right now to help treat that?
There are a number of ways in which it can be treated. So, research that we've done shows that there are various treatment approaches that appear to be quite successful, depending on both the actual condition that the person is suffering with, as well as a potential comorbidity, so co occurring disorders. What is very common in gaming disorder, as well as other related conditions, is that they are comorbid with other conditions. So, there may be a symptom framework where various mental disorders are present. So, in the case of gaming disorder, it's often the case that we've got anxiety disorders or depression, for example,
Hmm.
as being comorbid. And then, if we have comorbidities, then we also need to treat the comorbidities. It's very important to have a full diagnosis in order to find the best treatment approach. But currently, when looking at the research base, what we find on an international scale is that cognitive behavioral therapy seems to be a very efficacious and efficient treatment approach. So it doesn't cost very much, and it is able to help people within a relatively short time frame to actually improve their symptoms. That might not work for everybody. It really depends on the severity of the problems, as well as co-occurring disorders and other health-related issues. But it is indeed a very successful approach, generally speaking.
Can you give us an example of what the CBT therapy would look like for someone? Because again, I'm a little confused for someone that's gaming all the time, and all of a sudden they have their phone in their pocket, they're online all the time. So, what sort of CBT treatments would someone be working on to help with their gaming problem?
So CBT is cognitive behavioral therapy. It looks to change your thinking, to change your behaviors, and to change your emotions because they are inherently intertwined with one another. So in order to be able to change behaviors, we will have to look at the cognition, so the thoughts, as well as the emotions, so the feelings that are tied to that. So one important element of CBT is really to recognizing how these things belong together. So, for example, a patient, somebody who's indeed impacted by gaming disorder, might find out what are the triggers for their gaming. So, for example, they might use gaming to escape from their real life problems. They might have some problems with their boss at work, for example, and then they escape into the gaming world where they're able to relax, where they're able to think about something else, where they are able to distract themselves from those kinds of problems. And if such a trigger is indeed present and the person is able to realize that that kind of a trigger is present in their life and they're actually cognitively aware of that, they might change, they might adapt their behaviors. Yeah. So they may actually alternate their behaviors in such a way that potentially they find themselves a different coping mechanism, a more functional kind of a coping mechanism. Because we know that excessive gaming or excessive technology use can, in some cases, be a dysfunctional coping mechanism. And what we'd like to do is to try and create more functional coping mechanisms to be able to deal with everyday life problems.